Pharmacological aspects of food and drug interactions. Hello everyone, and welcome to today's lecture on pharmacological aspects of food and drug interactions. Food is essential for nutrition and health, but it can also significantly influence how medications work in the body. Some foods enhance drug effects, while others reduce efficacy or increase toxicity. Understanding these interactions is crucial for healthcare professionals to ensure safe and effective drug therapy. Definition of food-drug interaction. A food-drug interaction occurs when food, beverages, nutrients, or dietary supplements alter the absorption, distribution, metabolism, excretion, or pharmacological action of a medication. These interactions may result in reduced therapeutic effect, increased drug toxicity, unexpected adverse reactions, altered nutritional status. Food-drug interactions can occur with prescription medications, over-the-counter drugs, and herbal products. Classification of food-drug interactions. Food-drug interactions are generally classified into two major categories: pharmacokinetic interactions. These affect the movement of drugs through the body, including absorption, distribution, metabolism, excretion. Pharmacodynamic interactions. These affect the drug's action at its target site without necessarily changing drug concentration. Pharmacokinetic interactions. Effect of food on drug absorption. Drug absorption is the most common site of food-drug interaction. Food may delay gastric emptying, alter gastrointestinal pH, stimulate bile secretion, physically bind drugs, modify intestinal transport mechanisms. Example 1. Tetracycline antibiotics and dairy products. Calcium present in milk forms insoluble complexes with tetracyclines. Result: reduced drug absorption, decreased antimicrobial efficacy. Patients should avoid taking tetracycline with milk, yogurt, or calcium supplements. Example 2. Fluoroquinolones in mineral supplements. Iron, magnesium, calcium, and zinc can chelate fluoroquinolones. Result: significant reduction in absorption. Patients should separate administration by several hours. Effect of food on drug distribution. Certain foods may alter plasma protein levels and affect protein binding. When protein binding changes, free drug concentration may increase. Toxicity risk may rise. Although clinically less common, it can occur in malnourished patients. Effect of food on drug metabolism. Drug metabolism primarily occurs in the liver through enzymes such as cytochrome P450. Grapefruit juice interaction. Grapefruit juice inhibits intestinal CYP3A4 enzymes. Consequences: increased drug concentration, enhanced toxicity. Affected drugs include some statins, calcium channel blockers, certain immunosuppressants. Potential adverse effects include hypotension, muscle toxicity, excessive drug accumulation. Cruciferous vegetables. Examples: broccoli, cabbage, Brussels sprouts. These foods may induce certain metabolic enzymes. Result: faster drug metabolism, reduced therapeutic effect. Effect on drug excretion. Diet can alter urinary pH and kidney function. Changes in urine acidity or alkalinity influence excretion rates of some drugs. Examples: high-protein diets tend to acidify urine. Vegetarian diets tend to alkalinize urine. These changes may affect elimination of weak acids and weak bases. Pharmacodynamic interactions. Pharmacodynamic interactions occur when food directly modifies the physiological effects of a drug. Tyramine and monoamine oxidase inhibitors. Tyramine is found in aged cheese, fermented foods, processed meats. Normally, tyramine is metabolized by monoamine oxidase. When patients take MAO inhibitors, tyramine accumulates and causes massive norepinephrine release. Consequences: severe hypertension, headache, stroke risk, hypertensive crisis. This is one of the most classic and clinically important food-drug interactions. Vitamin K and anticoagulants. Vitamin K-rich foods include spinach, kale, broccoli. Vitamin K opposes the action of anticoagulants such as warfarin. Result: reduced anticoagulant effect, increased risk of thrombosis. Patients should maintain consistent vitamin K intake rather than completely avoiding these foods. Alcohol and central nervous system depressants. Alcohol can enhance the effects of benzodiazepines, opioids, sedative antihistamines. Consequences: excessive sedation, respiratory depression, impaired coordination, increased accident risk. Patients should generally avoid alcohol while taking these medications. Nutrient depletion caused by drugs. Interactions can also occur in the opposite direction, where drugs affect nutritional status. Examples include diuretics, may cause loss of potassium, magnesium, potential consequences, muscle weakness, cardiac arrhythmias, proton pump inhibitors. Long-term use may reduce absorption of vitamin B12, magnesium, calcium, potential complications, nutrient deficiencies, bone disorders. Metformin may decrease vitamin B12 absorption. Long-term monitoring may be necessary. Clinical significance. Food-drug interactions are important because they can cause therapeutic failure, increase adverse drug reactions, prolong hospitalization, increase healthcare costs, compromise patient safety. Healthcare professionals should always assess dietary habits, nutritional status, supplement use, herbal medicine use before prescribing medications. Prevention and management. Several strategies help minimize food-drug interactions. Patient education. Provide clear instructions regarding taking drugs with food, taking drugs on an empty stomach, foods to avoid, medication review, regularly evaluate, prescription drugs, OTC medications, dietary supplements, monitoring, monitor, drug plasma concentrations, clinical response, signs of toxicity when high-risk interactions are possible, interprofessional collaboration, effective communication among physicians, pharmacists, nurses, dietitians improves patient outcomes. Summary. Let's briefly review the key points. Food-drug interactions occur when food alters drug action or disposition. Pharmacokinetic interactions affect absorption, distribution, metabolism, and excretion. Pharmacodynamic interactions affect drug response at the target site. Common examples include grapefruit juice and CYP3A4 substrates, tyramine and MAO inhibitors, vitamin K and warfarin, dairy products and tetracyclines. Proper patient counseling and monitoring can prevent many adverse outcomes. Conclusion. Understanding food-drug interactions is a fundamental aspect of pharmacology and patient care. Awareness of these interactions helps healthcare professionals optimize therapeutic outcomes while minimizing risks. As future healthcare providers, always consider a patient's diet when evaluating medication effectiveness and safety. Thank you for watching. If you found this lecture helpful, please like, share, and subscribe for more pharmacology and clinical pharmacy content. See you in the next lecture.